My name is Dr. Jaworski. I am originally from Poland, and I can imagine how difficult it is for my Serbian or Balkan colleague to deal with CFS ME, because I got exactly the same experience from Poland, that this kind of illness was not very well recognized and obviously treated, and obviously I get much more experience since I start working in the UK. I work for a CFS ME clinic with the specialist post for 11 years, and my clinic cover east of Anglia, Norfolk and Suffolk, with about 2 million patients, so quite a lot of patients we are seeing every year. At the moment, I would like to focus on information they've been already provided by my colleague, and a lot of things been already told about long COVID and ME. But what we know so far, obviously, as few days ago, they formally recognized more than 500 million cases of COVID, which as been told before, gives about 10% of long COVID cases and about 1% estimated ME/CFS after this. So this gives a figure of the patient now coming to my clinic, roughly 80 patients every single week with suspected CFS ME, and I estimate that about 50-60 of those patients with referral, whatever the reason is for the tiredness, will finally get diagnosis of the CFS. And I really don't want to talk about the same thing that my colleague already discussed, but we all know that following COVID, many patients have lingering symptoms, and we estimated that for 3 months, about 30, even 35% of a patient got long-lasting problem. For after 6 months, around 10%, and after 1 year, we seeing most cases, unfortunately, of long COVID overlapping with the presentation of CFS ME, or may get absolutely the same diagnosis. So the symptoms they've been discussed: tiredness, fatigue, aches, short of breath, chest pain, cognitive dysfunction, autonomic dysfunction symptoms, and the most importantly, post-exertional malaise. They are very common for both group of patients with post-COVID and ME/CFS patient I'm seeing on a regular basis. What we can suggest for our CFS ME patient, and how we deal with the problem in the UK. In most area, we in the UK we got established CFS ME clinic. This is a bit patchy. I must say that some areas are better covered by specialist services, some still got problem. I'm not quite sure if you got very similar clinic in Serbia or a Balkan country, but I can guess that probably is not exactly the same. But how we get the procedure of referral to specialist services? So when the patient is seen by general practitioner or pediatrician or by physician, got referral to a CFS clinic for further investigation or assessment. And we all know that CFS is very heterogeneous illness. It's very challenging for the diagnosis, and it's much easier to see this on the paper that really recognize the real problem for many patients. And I totally agree with Christian, who said about listening to the patient, because sometimes the clue of the diagnosis is understanding how patients suffer. And it was already told that the tiredness with the CFS quite often is similar to the tiredness that patient got with chemotherapy. And indeed, I got patient, they previously got chemotherapy, or they got chemotherapy after having initial diagnosis of a CFS many years ago. And the comment quite often I have heard it was that actually ME tiredness was worse experienced that chemotherapy for various reasons. We all know that most cases with ME are triggered by infection. And that's very, very clear, and is so many times told about glandular fever, flu, Lyme, coronaviruses, including COVID infection, but we know about Ebola, Mycoplasma, and many others. Some cases with ME/CFS are related to stressful life event, to trauma, or even medical procedure, including surgery or even vaccination. Many clinicians at the moment really think that long COVID is very similar or almost the same like CFS and ME, and both illnesses are hugely overlapping, which obviously is a big problem for health authorities, for a general practitioner, and the most importantly for patients themselves, because many suffer in silence. Some of the patient got problem even to access primary care services at the moment, and obviously those people need help, and we can only support them in the best way. What we currently doing in regards of accessing CFS services. ME/CFS services in the UK are very overstretched, because we accept seeing patients initially with long COVID syndrome as well, trying to help with our occupational therapist to support those people they suffering for longer than 6 months. The long COVID syndrome therapists quite often are linked to CFS ME services with occupational therapists, but with physiotherapists, with mental health workers, speech and language therapists, and of course the specialist doctor who able to support people with this condition. Amolak already mentioned about treatment, the symptomatic treatment of the patient, and unfortunately this is very challenging. In the UK, it's very, very strong regulation about prescribing medication, and this is a bit problem to try to prescribe medication slightly outside the license, or the medication that may help individual but not really licensed, commonly used with ME/CFS problem. So at the moment we try to support our patient with proper pacing technique, with an advice how to manage daily activity. And as a doctor, I obviously offer support with the symptomatic patient, given some advice about pain management or mental health problem, any other support the patient needed. And indeed, they presented with extremely complex medical problem. And I really hope that more investigation, more publicity about ME/CFS as a result of pandemic, we all hope that will lead to finding further treatment, cure for CFS ME, but at the moment there seems to be quite difficult and even, I would say, in many cases unrealistic to think that it would be very quick fix for the problem, but we can only try, because the patient, they suffer from CFS, they're really very affected. And I know that even if we saying optimistically that many children recover, this is actually not the case, and this is not actually what happened. And many young people, many patients affected with ME are still significantly affected. I really would like to emphasize the situation about prevalence with ME/CFS. It's commonly told that this is about 0.4%, but according to some researchers, even up to 2%, which I believe is a bit exacerbated figure. But perhaps after COVID pandemic, this may be, in my opinion, higher than 1%. This is what I'm seeing from the local area, but of course we need more study and more research. They involved different country. So this is what I, with summary, wanted to present, being with a bit difficult situation that most of the topic been already covered by my lovely colleague, but I would like to say something from the front line, how difficult is with dealing with such complexity with the country that got recognized ME/CFS and established clinic for more than 20 years. So I can imagine that it would be very challenging for Balkan countries to do a very similar step forward. Thank you very much for listening, and all the best.
But, we have one question for you.
Yes.
It's from Mirjana Kiževski. I'm going to speak Serbian now, so you can listen English translation. Nju interesuje koji je standard za lečenje u United Kingdomu, odnosno za ME/CFS pacijente, uključujući, na primjer, doziranu fizikalnu terapiju, suplementaciju i drugo.
Okay. In the UK this year we got published NICE guidelines. So the guideline which in England and obviously whole UK is recognized as a leading document for the therapy. The standard therapy at the moment is based on pacing, proper advice about resting, about having some breaks at work for the patient and for the children, and an advice about management with daily activities, which sounds maybe a bit difficult for many doctors and patients to accept, but this is what is our basic therapy at the moment. But we got additional therapy for pain management, and this may include therapy as tricyclic antidepressant. Some of SSRI antidepressant may be useful for pain management. We still prescribe GABA type of medication, anti-epileptic medication like pregabalin or gabapentin for pain management. However, this is a bit resistance of long-term therapy with this type of medication because of commonly known side effects and addiction. So I will be quite reluctant to give an advice for long-term therapy with this for the patient. Another area that I always assess with a patient is mood, and whilst obviously we distinguish depression and anxiety from CFS ME as such, but it's very common that people with CFS ME, like many other people with long-term condition, with chronic condition, regardless of the reason, they got element of depression, anxiety for various reasons. You know, their life is completely different. They are not able to enjoy hobbies. They are isolated, like Christian said, children are very isolated. And those people finally develop a problem with mood. And I quite often address this with advice about therapy, whatever it would be, medication or talkative therapy as well. And of course, the treatment for symptoms wise, like sickness, vomiting, IBS like problem with additional therapy for this as well. So that's in general we cover with our clinic.
Thank you so much, Dr. Beata.